I'm a student physical therapist from the University of Michigan Flint, and your doctor sent me in here just to see how you were doing, see how you were moving, ask you some questions. Does that sound okay to you?
That's fine.
Okay. What is your name and date of birth?
Albert Dactone. Date of birth is 3/17/1961.
Okay, can I check your wristband? All right, it looks like I'm in the right place. So do you know why you are here today?
I had surgery a couple days ago.
Okay, what kind of surgery?
Bowel obstruction.
Okay. So what brought you into the hospital?
Severe abdominal pain. My stomach it hurt bad.
Mm-hmm. And you were throwing up and everything like that too, weren't you?
Yeah. It got pretty bad.
Okay. So how were you moving around before you were admitted?
Fine, I did everything.
Okay, so you had no problems with walking?
No.
No problems with stairs?
No.
You were driving on your own, all that sort of thing?
Yeah.
Okay. Do you live in a house or apartment?
I live in a house with my girlfriend.
Girlfriend, okay. Does your girlfriend share all the household chores and responsibilities like cleaning, cooking,
Yeah.
that sort of thing?
Sure.
Okay. How many steps, do you have any steps to get into the home?
There's 2 to get in our house.
Is there a handrail?
No, we don't have a handrail.
Okay. So, is it a 1 or 2 story home?
It's a 1 story, but then we have a basement.
Okay. How many steps to get into the basement?
I don't know, 10 or so.
Okay.
I'm not sure.
All right. Is your bedroom and bathroom on the main floor or in the basement?
It's on the main floor. Just
Okay.
my tools are in the basement.
Okay. Is your laundry on the main floor or in
Yeah.
the basement? So you have your tools in the basement. Okay. Do you work?
Yeah, I got my own shop, auto mechanic shop.
Okay. So what kind of things do you enjoy doing?
Pretty much, I'm on my feet all day and working, and pretty much after that I just want to sit down and relax and watch TV.
Okay.
I feel like I've done enough during the day.
That's fair. Do you do any kind of physical activity, even if it's on the weekends?
No.
Go. Okay.
No.
All right. So can you tell me a little bit about your past medical history? Do you have any health conditions I should know about?
I have high blood pressure, and I have migraines, so I take something for that, and then I do take something occasionally for my constipation.
Okay. What is your past surgical history? Do you have it?
I just had surgery 2 days ago. That's about it.
Nothing before that? Okay.
Nope.
Okay, so what are your goals for physical therapy? What can I help you with?
I want to get out of here. I want to get back to my shop and working. I don't, those guys there, they can't, I don't want to run without me. I need to get back to work.
Okay. Fair enough. Okay, so I'm going to check your vital signs, your blood pressure and that sort of thing. And then I'll check your sensation in your hands and legs just to make sure everything systemically is going okay. We'll look at your incision a little bit. I'll test some of your muscles, and then maybe we'll get to walking. Does that sound okay?
I don't know if I want to walk.
Okay. We will get to it. We'll talk about it a little bit more, but is it okay if I take your blood pressure in your right arm?
Yeah.
What's your pain like right now?
Like, what do you mean?
On a scale of 0 to 10, do you have any pain? 10 being like the worst pain you've ever felt, 0 being no pain at all.
It's about a 6.
Okay.
It hurts more when I move.
Okay.
So, of course, I don't want to move.
Yep. 115/54. And that is normal. Your blood pressure meds are working. But I'm going to write down that number so I don't forget it. And then I'm going to give you this for your finger, for your pulse ox, and your heart rate. Beep, beep. Whoops. Okay, so your pulse ox is 99% on room air. That's good. The closer to 100, the better. And then your heart rate was 78 beats per minute. And that is in a normal range. So I'm going to check sensation, okay? So I'll just be touching your hand like this.
Okay.
In different areas. You can, yep. And then I'll have you close your eyes. And then you tell me where I'm touching you at, or if you can feel me touching you, okay?
Okay.
So go ahead and close your eyes.
By my finger.
Which finger?
Right finger. Or left hand.
Which finger?
My middle finger.
Okay. How about now?
On my left hand on the side.
Okay. How about now?
On my left thumb.
Okay, how about now?
On my right pinky finger.
How about now?
Right index finger.
Okay, good. I'm going to have you squeeze both of my... You can open your eyes. I'm going to have you squeeze both of my hands. As hard as you can. I can take it. Okay, good. Alright, that feels normal. Now I'm going to have you lift that right arm up over your head if you can. Any pain with that?
A little.
Okay.
Not in my arm though.
Okay. I'm going to come right down here. Hold it there. Don't let me push you down. Hold it there. Good job. And then bring your arm down and bring it out to the side like this.
Like this way?
Yep. As high as you can. The pillow's kind of in your way.
Yep.
Okay. And then come down a little bit.
Uh-huh.
Hold it there. Don't let me push you down.
Right.
Good job. Okay. Then hold your arm like this. Make a muscle.
Okay.
Then don't let me pull you, okay?
Okay.
Hold it there. Hold it there. Good job. Okay. We're going to do the same thing on the other side, but we'll be mindful of that IV, okay?
Mm-hmm.
So bring that arm over your head. Yep, then back down to about here. Okay. Hold it there. Don't let me move you. Good. Now come all the way down and go out to the side.
Okay.
As high as you can. Okay. Then come back down to about 90 degrees. Okay.
Mm-hmm.
Hold it there. Don't let me move you. Good job. Okay, now make a muscle.
That's hard with this, with the IV.
Okay. Hold it there. Don't let me move you. Good job. Just gonna write those down, then we'll check out your legs, okay? Okay, I'm gonna uncover your leg. Alright, go ahead and bend this leg up. Bend this knee.
It hurts my stomach.
Okay. Hold it there. Don't let me pull you out, okay? Good job. Now I'm gonna move your leg up here. Just hurts your stomach a little bit.
Yeah.
Okay, hold your leg here if you can. Don't let me push down. Good job. Now straighten that leg out. Can you hold it here?
No.
Just hurts your stomach?
Yep.
Okay, go ahead and put it down. And then bring your foot up towards my hand. Hold it there.
I can do that
Don't
one.
let me push down. Ooh, yes you can. Good job. Alright, this one, go ahead and bend your knee up. There you go. Hold it there. Don't let me pull up. Okay, now I'm going to lift it up a little bit. Is that okay there? Hold it there. I'm going to push down. Don't let me push down. Good job. Can you straighten that leg out?
Uh-huh.
Can you hold it there?
Yeah.
Can you take some resistance? A little bit. Okay, go ahead and put your foot down. Then bring your foot up towards my hand. Don't let me push down. Those are strong. Good. Okay. Have you been feeling feverish at all?
No.
Okay. So after a major surgery like that, one thing that we are worried about is infection. So if you start to feel warmth, severe tenderness around the abdomen, which you will feel some, but if it's kind of extending outwards, that's kind of a red flag. That's something you need to tell your doctor. Or if you feel like you have the chills, like you're getting a fever, that's something that you want to talk to your doctor about as well, because that could indicate that you're getting an infection.
All right.
Or if you notice, you should look at your wound periodically, or your incision rather, and if you are seeing any like seepage, like a little bit of clear fluid coming out of it, that's fine. But if you see something that's like yellow or doesn't look right, then maybe talk to your doctor about that.
Okay.
So real quick, while I'm here, I'm just gonna look at your incision, okay? Okay, it feels a little bit warm, but not abnormal. It's pink, it's not red, so I'm not really concerned about an infection at this point if you're not feeling feverish or anything. Okay. So, I understand that the nurse tried to walk you yesterday and you were kind of not having it because you were in a lot of pain.
It hurts like a son of a gun.
Yeah. So, here's a few things. They're going to look at a couple of things to discharge you out of the hospital. First, you have to be good and not be having any infection or any other major complications going on. That's the first thing. Second, they need to make sure that you can walk. They also need to make sure that you have a bowel movement. And then also they need to make sure that you can at least walk up a couple steps so you can get into your home. Okay, so walking, it might hurt at first, but it'll probably feel a little bit better the more you keep moving. Then walking is also going to activate that GI system, that GI tract, and get your bowels moving so you can have a bowel movement. And then that will be checked off the list, and then we can try just a couple steps, and you'll be good to go. Okay, so this is kind of the first step to getting out of here and getting back to work next week like you want to do.
Mm-hmm.
I know you don't want to do it, but we can always sit and take a break as often as needed. But I would, in the very least, just like to sit you up, stand up, take a few steps, see how it goes, okay?
It hurts to sit up.
It does. Okay. And I think that's probably the worst of it, is sitting up. And then when you get past that point of sitting up, it probably won't be so bad walking. But I can show you a couple different ways to sit up that will put less pressure on that abdomen. I'm going to put some footies on you. Okay, so I'm going to have you log roll towards me. So you're just kind of moving your whole body towards me. And then you put that hand on this side of you, okay?
Mm-hmm.
Okay, so bend your knees up.
Ah!
Okay, log roll. Okay, good. Good, I know it's painful. I'm going to help you drop your legs off the side, and then I'm going to have you push up here, okay? So we're going to do it at the same time. Does that sound okay?
No, wait.
Okay.
Okay.
Okay, ready? 1, 2, 3. Okay, now just sit and relax for a minute. I'm going to get you a gown. Here, you can put this gown on. And then this arm. Okay, good. And oops, I'm gonna put a gate belt on you. See, the hardest part is over. That hardest part.
I don't know about that around my...
We're gonna put it higher so it's above your incision, okay?
Okay.
Well, we'll put it up above your incision. Way high. I don't suspect you're going to have any balance issues, so I probably won't be tugging on it too much, okay? But it's just there if we need it. Okay. Now, how tall are you?
5'6".
I also am about 5'6", so I think that will work for you. When you stand up, I'm going to have you push off the bed and then grab onto the walker, okay?
All right.
Don't worry about your IV. I'm going to be pushing that, and I'll be kind of standing behind you. So scoot to the edge of the bed so it's not quite so far of a trip. All right. So on the count of 3, I'll have you stand, okay? 1, 2, 3. Good job. Okay, just stand here for a moment. Here, we can put this in your pocket. Is there a pocket?
There's a pocket here.
Okay. Just stand for a moment. Try stand up a little bit taller. There you go. What's your pain level like right now?
Oh, it's like a 9.
Okay. Okay. All right. Just relax for a minute, and then we're going to take a couple steps. Our goal is just to get to that chair over there, and then we'll take a seat, and then we'll head back to your bed, okay? All right, whenever you're ready. Take as much time as you need. There you go. Good job. This is a good start. You're aiming for that chair, huh?
Yep.
This is a good start. The more you move, the easier it will be to move. Okay.
Do I sit down?
Yeah, but reach for the chair. Make sure your legs are touching the back of the chair, and then reach for the chair.
Yep.
As you sit down. Okay. Right there. Okay. Do you have a walker at home?
No.
Okay, so one thing that I think I'll talk to your doctor about is maybe sending you home with a walker, or in the very least a cane, just so you have something when you're walking. At first when you get home, and then also when you're in public in a few weeks, just if you want to use it just for a little bit of security. And it might help to get up those stairs too. All right, go ahead and give me your arm here. Take your arm. It was 109 over 64.
It's getting lower.
It is getting lower, and that just might be from making that transition from laying to standing. Sometimes your heart rate and blood pressure and everything has to adjust. I'm going to look at your telemetry to see what your pulse ox. Oh, I'm going to take it out of your pocket. Pulse ox heart rate is... Okay, so your pulse ox didn't change and your heart rate just went a little bit higher. It's now 82 beats per minute. I'm going to write that down. Okay. What's your pain level like right now, sitting down?
It's still about a 6 when I
Hold it
sit.
steady. Okay. All right, I think we're going to stand up and head back to your bed. I think that's a really, really good place to start today. You're doing really well. Just getting used to that moving again after having such a major surgery. Okay. So I'm going to help you stand back up. Here, you can put this down.
Okay.
All right, ready? Oh, yeah. I think you need the walker, huh?
It would just help, I think.
I think you're right. So when you stand up, I don't want you to don't be holding onto the walker when you stand. Push off the chair, and then when you are standing, grab the walker. Okay?
Okay.
Whenever you're ready.
Okay.
Ready? 1, 2, 3. Okay, grab on the walker. Grab on the walker. Is it your incision that hurts, or kind of your insides, your internal?
Just my stomach, just
Okay.
where the incision is.
Okay. I think once getting moving and then having that bowel movement will help a lot. That pain. Okay. Good job. So when you go to sit back down, You're going to back up to the bed and then reach for the bed with both hands. So you can come a little closer to me so you're a little closer to the head of the bed. So make sure the back of your legs are touching. And then reach one hand, then the other hand. Good job. Okay. I'm gonna get your gait belt off you. What's your pain level like right now?
Still like maybe a 6.
Okay. We'll take your gown off. I'm gonna steal your footies off you. Okay. Now we're gonna lay down the same way that you went from a laying to a sitting position, okay? So you're going to go down that way onto your side, and I'll help you move your legs up, and then it'll be easier to roll over, okay?
Okay.
The least work of the ab muscles. Okay. So whenever you're ready, I'll start moving your legs.
Oh!
All right. You did really well. So I'm gonna look at your vitals one last time. So your pulse ox is holding steady at 99. That's really good. Your heart rate is a little bit higher, 82. And then I'll take your blood pressure again. All right, look at this on you. Okay. (115/58). So that's staying pretty steady too, so that's a good thing. Okay. Let me make sure I got everything on my list. So you said you don't have any walker or cane or anything at home, right?
No.
Okay, so I'll make sure I make a note for your doctor that you might need that for home. And then the more we keep moving, if you can have a bowel movement, and then of course nothing else happens like a major infection or something like that, and we can practice those steps the next time I'm here. If all those things can happen, then you'll be all set to go home, okay? So just keep in mind that moving is really well. I know they took your Foley, they discharged your Foley, so now you have walking to the bathroom and that sort of thing. So if you do need help walking to the bathroom, just grab a nurse and they can help sit you up. Practice that log rolling to the side, and that'll help a little bit. So other than that, I'll be here tomorrow, and I anticipate that you will be discharged home with just some medical equipment in a couple days or so, depending on kind of how those things play out.
All right.
Do you have any questions?
No.
No. Okay. So I will be back tomorrow. I'll talk to your doctor, or in the very least give him a note. So I'll give you your call light. So if you need anything, just hit the button and the nurse will come running and she'll help you. If you want ice chips or if you want to try eating something or have any questions about that, the nurse can help you out there, okay?
Yeah.
Okay. So I will be back tomorrow. Thanks so much.
Thank you.